discuss about the attachments of the ilium. So here in this, here you can see that this is the ilium, the upper expanded part of the hippo is known as ilium. The ilium has two ends, the upper end and a lower end. The upper end is present in the form of a curved ridge which is known as iliac crest. This iliac crest extends from the anterior superior iliac spine till the posterior superior iliac spine. The ilium and the lower end forms the 2/5 of the acetabulum. As you all know that the ilium forms the 2/5 of the acetabulum, the pubis forms the 1/5 of the acetabulum, and the ischium forms the 2/5 of the acetabulum. Okay, now the ilium has three borders and three surfaces. This is the anterior border of the ilium, which extends from the anterior superior iliac spine till the acetabulum. Then this is the posterior border of the ilium. It extends from the posterior superior iliac spine till the upper part of the posterior border of the till the lower part of the posterior border of the ischium. Okay, so this is the posterior border. This is the anterior border of the ilium, and there is one more border, that is the medial border, which is present on the inner surface of the ilium. This is the medial border which extends from the iliac crest till the iliopubic eminence. This eminence you can see here, this is the iliopubic eminence which I am holding. This is the iliopubic eminence. Okay, the anterior border, you can see it extends from the anterior superior iliac spine till the acetabulum. Okay, in the anterior border you have the anterior superior iliac spine, then below the anterior superior iliac spine there is a notch, then below the notch there is another spine. This is known as anterior inferior iliac spine. Okay, and on the same way on the posterior border there is posterior superior iliac spine, then few centimeter below the posterior superior iliac spine there is again another spine which is known as posterior inferior iliac spine, and below this posterior inferior iliac spine there is a notch. This is known as greater sciatic notch. This notch is known as greater sciatic notch, and below there is the ischial spine, and thus just below that spine there is again another notch which is known as lesser sciatic notch. So today we are concerned about the ilium only, just the upper part. Okay. And on the medial border can be divided into three parts: the anterior, middle, and the posterior part. The anterior part of the medial border is known as arcuate line. The middle part forms the posterior boundary of this auricular surface. Okay, and the upper posterior part is rough. Okay, so we have discussed about the borders. Now there are three surfaces also. The three surfaces are: the outer surface is known as the gluteal surface, the inner surface, this is the iliac fossa, and here we have this sacropelvic surface. Here in front of the medial border we have the iliac fossa, and behind the medial border we have the sacropelvic surface. Okay. Now let's discuss one by one regarding the attachments. Okay, so let's start with the iliac crest. The iliac crest extends from the anterior superior iliac spine till the posterior superior iliac spine. The iliac crest is divided morphologically into two parts: the ventral part 2/3 part and the dorsal 1/3 part. The ventral 2/3 part has an outer lip, inner lip, and an intermediate region. The dorsal 1/3 part has a lateral slope, a medial slope here, lateral slope, medial slope, and an intermediate region. Okay, now the attachments on the outer lip, in its whole length it gives attachment to the fascia lata. Fascia lata is it is the deep fascia present in the thigh. Okay, and on the outer lip, just 5 centimeter behind this anterior superior iliac spine, there is a tubercle present. There is an elevation present on the outer lip 5 centimeter behind the anterior superior iliac spine. This tubercle is known as the tubercle of the iliac crest. So the area between on the outer lip, in front of the tubercle of the iliac crest, there is attachment of tensor fascia lata. Okay, and in the anterior 2/3 part of the outer lip there is insertion of external oblique muscle. On the posterior 1/3 part of the outer lip, there is attachment of quadratus lumborum muscle, sorry, latissimus dorsi muscle. Latissimus dorsi muscle is attached on the posterior 1/3 part of the outer lip of the iliac crest. Okay, on the inner lip there is attachment of, in the anterior 2/3 part there is attachment of transversus abdominis muscle. Deep to that muscle there is fascia transversalis and fascia iliaca. In the posterior 1/3 part, there is attachment of quadratus lumborum muscle. Okay, and in the intermediate region, there is attachment of internal oblique muscle. There is origin of internal oblique muscle takes place from here, the intermediate region of the ventral segment of the iliac crest. Okay, now coming to the dorsal segment. The dorsal segment has an lateral has an outer lip knot. There is a lateral slope, a medial slope, and an intermediate region. The lateral slope gives attachment to gluteus maximus, and the medial slope gives attachment to the erector spinae muscle. Okay, erector spinae muscle, gluteus maximus muscle. Okay, now let's see the attachment on the anterior superior iliac spine. The anterior superior iliac spine gives attachment. The anterior superior iliac spine gives attachment to sartorius muscle. Sartorius muscle is the muscle of front of thigh, and there is attachment. The lateral end of the inguinal ligament attaches on the anterior superior iliac spine. On the anterior inferior iliac spine, there is attachment of the iliofemoral ligament. The iliofemoral ligament is attached here, and there is one more muscle attached over here. The straight head of rectus femoris muscle is attached on the upper part of the anterior inferior iliac spine, and in the lower part there is attachment of iliofemoral ligament. Okay, now coming to the surfaces. This is the outer surface is the gluteal surface. It is convex anteriorly and concave posteriorly. This gluteal surface is divided into 4 parts by 3 gluteal line. Okay, so here posteriorly we have the posterior gluteal line. This is the posterior gluteal line. Then we have the anterior gluteal line. Then we have the inferior gluteal line. The posterior gluteal line is the shortest gluteal line. It starts 4 cm in front of the posterior superior iliac spine. It runs downwards and ends just above the upper border of this greater sciatic notch. Here it is ending. Okay, and then we have the anterior gluteal line. This anterior gluteal line starts 5 cm behind this anterior superior iliac spine. It runs backwards and then downwards, and then it ends at the upper border of the greater sciatic notch. And the inferior gluteal line is ill-defined. It starts just above the anterior inferior iliac spine, and then it runs forwards, and then it ends at the apex of the greater sciatic notch. So in this way, these 3 gluteal lines divides the gluteal surface into 4 parts. The area behind the posterior gluteal line gives attachment to gluteus maximus muscle. The area between the posterior and anterior gluteal line gives attachment to gluteus medius muscle. The area between the anterior gluteal line and inferior gluteal line gives attachment to gluteus minimus muscle, and the area below the inferior gluteal line gives attachment to the reflected head of the rectus femoris muscle. There is a groove present over here. Here the reflected head of the rectus femoris muscle attaches. Okay. Now coming to the inner surface, the iliac fossa. The upper 2/3 part of the iliac fossa gives attachment to the iliacus muscle, and below there is a bursa, which is the bursa of the iliac. This is the iliac tuberosity. It is elevated in the center and depressed rest all over. The anterior part of this iliac tuberosity gives attachment to the interosseous sacroiliac ligament. Then posterior part of this iliac tuberosity gives attachment to the dorsal sacroiliac ligament. Here in the upper part there is attachment of iliolumbar ligament. Then on the auricular surface is articular. It articulates with the sacrum to form the sacroiliac joint. Anteriorly here there is again attachment of the ventral sacroiliac ligament, and below this auricular surface, antero-inferior to this auricular surface, there is pelvic surface. Here there is attachment of piriformis muscle. Okay. So this completes the, okay, let me discuss about the arcuate line also. This is the medial border. The medial border of the ilium can be divided into three parts: the anterior, the middle, and the posterior part. The anterior part of this medial border is known as arcuate line. This is the arcuate line, and the middle part forms the posterior boundary or the posterior border of this auricular surface, and the posterior part is rough. So this completes the attachments of ilium. Thank you.